Good evening and welcome. Thank you so much for being with us today. My name is Anna Iltis and I direct the Center for Bioethics, Health and Society here at Wake Forest, and also the undergraduate minor in Bioethics, Humanities and Medicine, and I teach in the philosophy department. So thank you very much for coming today. It's my pleasure and my privilege to introduce Dr. Zubin Master to you. Dr. Master is an associate professor in the Department of Social Science and Health Policy at the Wake Forest University School of Medicine, and he's also affiliated with our Center for Bioethics, Health and Society, as well as the Wake Forest Institute for Regenerative Medicine and the Maya Angelou Center for Health Equity. Dr. Master joined Wake Forest earlier this year after being at Mayo Clinic's Biomedical Ethics Research Program and previously at the Albany Medical College. And he's also worked for the Federal Public Service as a Senior Policy Advisor for Health Canada. He is a member of the International Society for Stem Cell Research Policy, Public Policy and Education Committee, as well as holding a number of other important roles in our field or journals and other things. So he does a lot of work, and I'm not going to go through his entire CV for you. His research interests broadly cover ethical and policy issues related to stem cells and regenerative medicine, genetics, research ethics, and the responsible conduct of research. His current NIH funded study aims to understand how beliefs and perceptions of patients seeking experimental care are influenced by misinformation or disinformation, and how to devise potential strategies to correct misinformation and elicit behavioral change. He's also interested in understanding factors that contribute to health disparities surrounding novel areas of regenerative medicine and developing strategies for equitable care. He has published over 100 articles, and his work is presented regularly nationally and internationally. So it is really a pleasure to have you with us today. Thank you so much. When he finishes speaking, we will have time for some questions and discussion, and then a reception right next door. So we hope you will stay and join us for that. So thank you, and please join me in welcoming Dr. Zubin Master.
Thank you. Thank you, everyone. So can everyone hear me through the mic? Okay. Can we make this informal? If people have questions, I can moderate my own talk. So just feel free to ask if it's something I'm going to, yes?
Yankees or Dodgers?
Yankees.
If people do that, please kind of repeat the questions. So
Sure. Okay, I can totally do that. Yeah, so we can just, make it very informal. Okay. So I'm going to talk about chronic disease patients seeking unproven stem cell types of therapies. I'm going to talk, let me go through my conflicts of interest. I am not paid by anybody ever other than my school. But I do, as Dr. Iltis said, I am on ISSCR's education committee. ISSCR is the International Society for Stem Cell Research, one of two big international societies, and I sit on their public policy committee and education committee, and some of my presentation will touch on things that we've done here. So I'm going to talk a little bit about science communication, okay, very broadly, very generally, and how it relates to unproven or stem cell research in general. I will talk about the misinformation environment, specifically around fake treatments for patients with all kinds of chronic diseases. I'm going to talk about patients themselves. I'm going to tell you where did they get information from? Why is there a lot of misinformation? Does it affect their beliefs and attitudes? And then the main crux of this talk is to give an argument, a conceptual argument as to whether persuasive communication, persuasive education for patients is ethically permissible or not. You can be the judge. And if so, what does that kind of communication look like? Okay. So those of you that may not know about stem cells and regenerative medicine, they're kind of intertwined, right? Stem cells can create certain stem cells can create almost every cell of the human body. These things called embryonic stem cells or pluripotent stem cells can create all adult tissue. Why is that important? Well, when you get older, things break down. Trust me. So, people need to regenerate it or they need to somehow treat it. So regenerative medicine has been, thought of as potentially something that's pretty important and could actually be curative, not just a Band-Aid treatment, but an actual cure. And we'll talk a little bit about that. So first part of the talk, what does the science communication environment look like, and why is there so much misinformation around unproven stem cell therapies? Okay, so this data comes from a wide range of scholars. There's been a lot of hype, and there's been hype in every kind of technology. What do we hear about hype now? Can anybody tell me? We hear it all the time. Every medical college is interested in it. You got it, AI, right? We hear everything about AI is going to change the way we practice medicine. AI is going to change the way you do school. AI is going to change everything, right? We get the same type of hype around stem cells. And, you know, when it comes to stem cells, hype is really how do you predict the future of this nascent technology? Is it going to be fact-based, or are they going to exaggerate almost tantamount to lying, where it will distort people's understanding of whether a stem cell therapy is here today or not? So the public really started hearing about stem cells in the late 90s, early 2000s, when they first discovered the first human pluripotent stem cell. And here's a bunch of analyses, content analyses of US News. And you can see some of the dates around 2000, right? And if you just read a couple of these quotes, visions of a world free of sickness and disease. So these are the types of messages that the public has been hearing about since literally 2000. Presidents have talked about it. Presidents have tried to veto or permit certain types of stem cell technologies. State-based organizations have created funding for stem cell research. We've been hearing stem cells, regenerative medicine for a pretty long time publicly. Again, what are these promises, right? So, you know, you can see some of these. This is the original Superman, Christopher Reeves, who died of a spinal cord injury and was a big, big advocate around stem cell research. So just as these pictures show you, the main thing is it could be, again, a curative for all types of diseases and disorders where we don't have any real good treatments. Alzheimer's disease, Parkinson's disease, heart attacks, COPD. You name a disease, there's probably at least an unproven stem cell therapy or at least research that's being done on them. Let's jump 15 years later, okay? So remember those articles I showed you? They're around 2000, right? This study was done in 2015 by Kalina and Tim. And they also looked at US, UK, and Canadian newspapers, and they found the same thing, right? The chart on the left basically shows that around almost 70% of people in these news articles that were commenting said stem cells are going to be, stem cell therapies are going to be just around the corner. They're going to be here in the next few years or very soon. And if you see the chart on the bottom right, it basically shows that most of these had a very optimistic viewpoint of stem cell therapies, not pessimistic and not value neutral. So, what does hyping do? Can anybody guess? Kind of has the answer on the slide a little bit. What happens if we publicly hype a technology?
Everyone wants it.
Pardon me?
Everyone wants it.
Everyone wants it. But what if it's not there? What if it doesn't really exist? Pardon?
Fund it.
Well, true, fund it. It distorts so science communication folks would know. It would distort public's understanding of science. Why? Where do all of you learn science? Maybe in school, right? For all the people that are not in school, where do we learn science? Say again? You bet. The media. So Dorothy Nelkin, way before the internet was really even around, in 1987 said, we learned science primarily from, at that time, we call it now, legacy media, right? Radio, broadcast, television, physical newspapers. There was no such thing as the World Wide Web at the time. So we learn it from there. So if we have a warped understanding of a technology, of science, well, that may increase public's expectations. And if the public's expectations of this technology are unmet, well, that could result in a loss of public trust, maybe even public support for that science. This has become such an issue that the International Society for Stem Cell Research, remember I told you that one of the motherships of scientific societies, for stem cells, basically in their first iteration of their clinical translation guidelines, their policy said really scientists need to stop hyping stem cell technologies. And why? Because it created, to some degree, this unproven stem cell industry, which I'll talk about in a second. We've also argued that it should really be taught in any kind of ethics classes for scientists, how to publicly communicate responsibly. So, what's the reality? Do we know how many does anybody want to wager a guess how many stem cell therapies or even regenerative therapies broadly there are today that you can get treatment for? Above 20 or below 20? I see below 20. Down? Okay. Yeah, down. That's correct. Really, the biggest one is what we call bone marrow transplant or hematopoietic cell transplantation. This is when you have certain blood cancers like leukemia. They will pretty much eradicate your bone marrow and replenish your bone marrow. And that will reconstitute your immune system and therefore hopefully attack the cancer and get it back to check. There's some things with skin. Skin's very easy to deal with. There are other types of regenerative therapies around the eye. I think the biggest one now is called CAR T. It's not a stem cell therapy, it's a T cell therapy, but they modify T cells of cancer patients and it actually recognizes the cancer and can kill the cancer. And that's now been FDA approved and out there. But this is a 2020 report and it's not that much better now. Generally, there has been a lot of growth. There's more stuff in clinical trials at later phases, phase 2 and phase 3, meaning it's advancing in the context of clinical research. But as I mentioned, there's not that many stem cell or regenerative therapies out there today that you can take. But that hasn't stopped this big industry, which we call unproven, unregulated, unapproved, stem cell therapy, stem cell treatment, stem cell intervention. I'm sorry, I'm going to use these terms pretty interchangeably. It's this industry where they're selling unproven stem cell treatments for any diseases. What is unproven? Kind of challenging to define. It generally means there's not enough scientific evidence to be giving it as a therapeutic. So your doctor should not be prescribing it to you. Generally, these are also not approved by the FDA, so they shouldn't be given or shouldn't be marketed as a therapy. These are just the countries where we've actually documented stem cell clinics. There's a lot of research on this. Not every country has been investigated, but you can see there's dozens of countries where there exist one or many unproven stem cell treatments. So let's talk a little bit about this treatment industry, okay? As you can imagine, it's targeting an older adult population, right? Averaging about 65 years of age. Patients who have taken one of these unproven stem cell therapies, they have been physically harmed. But not every patient who gets an unproven stem cell therapy will be harmed. Why? Well, whenever I put anything inside your body that's not from your body, what happens? What does your body do? Say? I'm sorry. Right. It rejects it. It attacks it. It looks at it and says, just like a virus coming inside your body, you get a fever, but what's happening? Your immune system is saying, this is not from me. I'm going to get rid of it. And that's what happens when you put a foreign cell inside your body. It's like immune rejection of an organ. Same kind of idea. Your body's more likely than not to get rid of it. But stem cells can divide pretty rapidly. And so a lot of people who have taken unproven stem cells have actually developed cancers and tumors. Some have died. Some have developed, basically heart attacks. People have had tremors. 3 women in a Florida clinic were blinded for getting stem cell treatments for an ocular condition. So there are quite a few harms. But because we're not doing this in a clinical trial, it's really hard to document these types of harms, right? People are going out there. These clinics are not reporting that. Why would they, right? Again, this is a for-profit industry. None of this is covered by insurance. So patients are paying out of pocket to go and get these unproven stem cell treatments, okay? So of course, when it doesn't work, there's also financial harms. Back in the day, these things used to be 20, 30 grand a pop. So you can imagine, people that are not wealthy are not going to be able to afford it, or they're going to mortgage a house or like put a second mortgage or something to be able to get a stem cell therapy for their condition, okay? Now, the last bullet, the US alone, Lee Turner has done a lot of documenting around the US. There were 570 clinics in 2016. Now there's upwards of 2,700 clinics in the US only. But remember, this is an international industry. So, talked about the industry. What does information look like around stem cell treatments that patients or the public may find out? So, there are several studies that literally show that the environment for unproven stem cells is completely surrounding misinformation. A lot of it is on the internet. And on the internet, it's primarily clinic websites. So here's just a few pictures of some of the clinic websites that have received FDA warnings, that have been undergone lawsuits, like the Lung Institute. And they are great. They are slick websites, way better than navigating a government website or Atrium's website. Very simple, really straightforward, and it tells you all these great things that stem cells can do. I'll talk about that. These clinics also have free seminars. They distribute flyers. I'll show you some of their news ads. They are found on social media. And yeah, I've been to one of these seminars where after, this was when I was at Mayo Clinic, and so it was in Rochester, Minnesota. And, there's someone here speaking to a bunch of patients. They're all interested in, and of course, if you come to these seminars, you get a certain amount of money off your stem cell treatment, right? So they give these types of hard sale techniques because, they've already informed you. Their doctor doesn't have to re-inform you, right? And near the end, people were kind of peeved at Mayo because Mayo was not catering to these folks, and these folks felt disenfranchised or felt that they weren't taking their concerns seriously enough. And the speaker was promoting it, actively promoting it. People would distrust the FDA. I'll talk a little bit about that. And again, they were promoting it. So they do actively promote mistrust of regulators, mistrust of medical institutions, et cetera. And what they're trying to do, what these clinics are trying to do, is they're trying to showcase that their stem cell treatments are legit. And they do this in various different ways. So here's a flyer that actually came to one of my students in the mail, so I thought it was pretty cool to keep as a background. So here's one that I just ripped off the internet. And this was for a stem cell seminar. So it'll say things, so these people are giving it for a lot of like orthopedic injuries, so sports medicine, injuries or shoulder tears, things like that. And again, you can see things like before you operate, before you medicate, regenerate. So patients have told us a lot of times they don't want to go under the knife, and if they can use a less, non-surgical, less invasive type of technique, they would rather do that. So they're playing on that. So here's another advertisement. I love this one because I work a lot with orthopedists. There is not one clinical study that shows that, so this is bone-on-bone knee osteoarthritis. It's a pretty common condition. It really impacts people of an older adult population. If you're an athlete, you're probably going to get it quite young. But yeah, we're not supposed to be bouncing around on our knees all our lives. So this is a pretty painful condition. You can see that the two knee bones are going to grind. It's going to hurt quite a bit. There's never been a study where they've put in any kind of stem cell and you get this nice space of different tissue separating the two knee bones, okay? That's never occurred. So I don't know if this literally was the before shot and this is the after shot. I'm not a diagnostician. I can't read this x-ray, but that's just literally fake. So Emma Froh did this really nice study where she showed what kind of evidence might be convincing to a patient. And Clinical trials, so a lot of these clinics don't put up, oh, we do clinical research. They don't put up any clinical trials, or if they do, they're unrelated. So they may be a stem cell therapy for something, but you're getting it for a completely different condition. Or it may be something like a phase 1 trial. Now, those of us that know a little bit about clinical science, phase 1 is like just testing safety. It's not even remotely close to being effective. It's not even testing for effectiveness. They'll do things like that. Or, patients have told me, oh yeah, it works in mice, so it works in us. Oh no, that is very far from the truth, because if lots of things work in mice, but they don't always work for us. So you don't see too many clinical studies being reported. What they do report is the qualifications of the doctors, the qualifications of the clinic staff. They highlight technical things about how stem cells work. And they may highlight patient testimonials quite a bit. And that's really the major way the selling goes, because they hear patients that have gotten a stem cell therapy that has worked miraculously for them, so why shouldn't you? So we did a study a while back to understand narrative communication. Narratives are pretty interesting because they're powerful. When you get a pamphlet from, let's say, a doctor's office, it gives you all these facts, all these, statistical numbers. People forget, people may not believe it, people may just, they look at, 35% risk versus benefit very differently amongst each other. But narratives are a really powerful way because it's a story. And you're going to remember that story for a number of reasons, because you may reflect on it, it may resemble you, you put yourself in that situation, and therefore it increases believability. So we want to understand how these patient testimonials, which are just narratives, it's a patient's story about their therapeutic journey, how does that impact? And we want to study it on social media. At the time, we thought social media was a major way of having misinformation. We picked YouTube for a couple of reasons. It's a video-based platform, so it's pretty good with people that don't have a lot of health literacy. Also, YouTube and Facebook are more actively used by an older population. So likely a patient might have seen a YouTube ad surrounding it. And so when you go to a clinic website, you have written testimonials and you'll have a lot of videos. And then they also upload those onto YouTube. So we studied it. Now, there's been a lot of studies around this. So I'm just going to give a synopsis from our study, but it very much is similar to other studies. A lot of these websites don't talk about risks. They don't talk about risks of an unproven stem cell treatment. No one talks about a cost, right? Because why would anybody want to hear you have to pay $10,000? No one says that these stem cell therapies are experimental or that you need like regulatory oversight. So this is something common in every talk, every study. So we found similar types of things in these YouTubes. But here's the powerful part. I'm going to just show a few that I want you to pay attention to. 91% of the about 150 videos we analyzed all talked about awesome improvements, right? So they would show something like, oh, I couldn't move my arm, and then after stem cell therapy, I can move my arm. So they'll be acting out these scenes. A lot of patients that go and get stem cell therapies, they say, their docs at Atrium or wherever, they've been dismissive to their concerns. They've lost all hope. This is the language that they use. So 26% of the patients in these videos say they found hope again in the stem cell therapy, in the doctor, or in the clinic. Okay? I'll unpack this in the next slide. 54% of the videos praised the provider, praised the stem cell treatment. And again, almost a third recommended to the viewer, who more likely than not might be another patient, you should get the stem cell therapy just like me. Here's just some of the language that they use to praise either the provider, the stem cell treatment, the clinic staff. Here's some of the sort of longer quotes from an ALS patient or an MS patient, and some shorter phrases as well. So at the end of the day, this is a pretty powerful way of conveying to another patient that maybe a stem cell therapy is right for you, okay? So again, The clinics use a range of different techniques, right? They talk about their prestigious board. They've done weird things. They try to associate themselves with major medical centers like at Stanford, Johns Hopkins, Mayo Clinic. They will give publications, and I'll talk a little bit about that. And again, the main way they showcase all of this, patient testimonials. They're trying to show, I'm a patient, it worked for me, it'll work for you. Okay, so let's look at patient sources of information. The question here is, how do we know patients are actually looking at any of this? And even if it is, how do we know they're actually being misinformed? So, all different types of media, right? Legacy media and internet-based media. For unproven stem cells, this is where patients get most of their information, okay? Almost 100% go and Google something, okay? Social media, not as much. We're thinking about 5-10%. And patients talk to people. And who do they talk to mostly? They talk to stem cell providers, right? They go and call up the clinic. They do site visits to the clinic. They also talk to friends, family, maybe patient advocates as well, okay? And again, for the internet, it's predominantly Googling everything. So we did a study a few years back into 2022 where we've tried to identify patients that came to one of our major medical centers in Florida. How do they find information? So as you can see, a bunch of them, 40% of them did some online research, okay? A lot of them also talked to people, friends and family. And again, social media, not as much. Stem cell seminars, not as much. Legacy media, not as much. But again, 40% of the patients out of 533 actually said that they contacted a clinic before they came to Mayo Clinic to find out about a stem cell therapy. So what kind of information do they get? So again, social media, not used. So we did a study where we did a bunch of interviews with patients, and I'm not going to get into all the empirical analyses and stuff, but we can classify patients as either someone who is have very little interest, which we call low seekers of unproven stem cells, or they're really interested or have already gotten an unproven stem cell therapy, which we call high seekers. So I'll show you a little bit of data between low and high seekers. So both low and high seekers love information. Everybody that wants to get an unproven stem cell therapy has scoured the internet, okay? Low and high seekers do read things from reputable websites like the FDA, NIH, CDC. ISSCR, as I'll show you, has done so much on patient education, not one of our 60-something patients had ever heard of ISSCR. They do find studies, but they don't really understand the studies, and they tell us this. They rely on secondary sources of information. And where the low seekers rely on secondary sources of information from FDA, NIH, CDC, Atrium, high seekers really trust it from the clinics, and that is one of the big issues. There is some misconceptions. So this is something we talk about in bioethics. It's called therapeutic misconceptions, the idea that patients, when they come in to do clinical care, they go and see a doctor. Where? At a hospital. When they go for research, what do? Well, they go and see a doctor. Where? At a hospital. So sometimes people may not understand that they're in a clinical setting to get care versus getting therapy. So that's something that we saw. And if you read the quote, this patient is literally conflating the two completely. Naturalness. This is something everybody in society has talked about, right? What is natural is good. What is natural is better, right? It's what we call the naturalness fallacy, right? So stem cells, because they can come from embryos, but they can come, they're inside all of us right now. There's adult stem cells. So most of the time, patients get stem cells from their own body, and that's put back into their own body. And so they think that that is better. All of them complain about the side effects from drugs, and they take a lot of drugs. So they think that stem cells are better, they're safer, because they're natural. We are the first to actually document some type of conspiratorial type of thinking. The biggest one, and this is predominantly with high seekers, is that, so you may know that the FDA is the major regulator for drugs, right? So you got to get it approved by the FDA before you can market it. So a lot of patients, high seekers, tell us that the FDA is colluding with big pharma to keep these Band-Aid treatments alive, but the little guy is there to empower patients. He or she is giving the stem cell therapy, and the FDA is trying to shut them down. Okay, so we hear a lot of that as well. How do patients process this information? So everyone thinks we are sort of cognitive thinkers, and that's not necessarily true. We found that both low and high seekers use things like heuristics, which are just simple mental shortcuts, or bias. They have biases. So for example, one of the things we hear from high seekers, I got nothing to lose, might as well take a stem cell therapy. But you do have something to lose. Your condition can get worse. You will pay money. Your family will need to help you even more potentially. Low seekers, if it's too good to be true, then it probably is. Well, again, a heuristic. Authority bias. So authority bias is the idea that someone of authority, let's say a doctor, is saying do X, and so they will just listen to what the doctor says without cognitively thinking much about it. Affect heuristic. If you have strong emotion for somebody, let's say a stem cell provider who has spent an hour with you talking about stem cell therapies, you're more likely to believe them. You're more likely to say, this person cares about me. And that's literally what this quote said. The person cares about me. They want me to make an autonomous decision. It's important to them that I do so. So they must, I'm going to believe what they say. So just a little bit more. Again, high seekers think stem cells are safe. Here's a great quote where someone says, the most you can get is an infection. I work in a farm. I've stepped on cow poop and rusted nails. I've never been infected. Okay, you can die from a unproven stem cell therapy. Low seekers, they don't think they're safe or effective, so they don't really, they just don't believe it. Some high seekers have unrealistic expectations. They think it's going to be a cure, but most of them have like something realistic. They think there's going to be some modest improvement. Maybe it'll take them off therapy, like some drugs. Maybe it'll improve their health a little bit, etc. Okay, so here's the crux of my argument, right? A need for persuasive communication. Show of hands. Do you think it's ethical, before I go on to give my argument, that we should, as let's say public health researchers or public health institutions, give persuasive communication? What do you think? We do it all the time. How many think that it's absolutely unethical? You can? Okay. So I think it is ethical, and that's the argument that we put forward. So there have been many, many ways to stop this flourishing industry, right? And they target a range of different people, okay? Most academics have concentrated on these two: regulate and discipline physicians. That's targeting the supply side of things, right? If we stop unproven stem cells from being there, well, then patients aren't going to get them. But almost no research is being done on consulting patients, educating patients, giving them better choices. And that to me is targeting the market side. If we can convince patients that you really don't want to get an unproven stem cell therapy, well, that might dissuade them. So we feel that there's, and I'm saying we because we've published a paper on it, we feel that there's three types of communication, and they all have advantages. I have a hard time seeing manipulation to ever have any advantages, but didactic and persuasive can, okay? So didactic education, it's the dominant form that's out there right now, and I'll show you some examples of that. Persuasive communication is not trying to inhibit anybody's autonomy. It may say, don't go and get an unproven stem cell treatment because of A, B, C, D, but it's not stopping them. Manipulative communication is the communication most of these stem cell providers are using. What they're doing is they're basically making it seem that there's only one option left. And that is not, it doesn't allow them to use their cognitive resources to basically make an autonomous decision. And so we basically think manipulation in public health cases, it'd be a really hard time to ever think of when it might be ethically okay. But we do think persuasive communication is. So let's unpack those. Didactic. These are patient handbooks that are out there, patient websites. This one we created in 2014, it was a long time ago. The International Society for Stem Cell Research has done a tremendous amount of patient resources, which is really sad when I inform them when our study gets published and no one's ever heard of it. But it is. So didactic education, again, it's the most abundant, is primarily written, okay? It's written by scientific organizations, scientific societies, medical societies. FDA has done certain things, certain funding agencies have done certain things. It is based largely on science deficit model. So do people know what science deficit is? Science deficit, so back in, I don't even know what years, like 50s? They did a lot of large barometer studies of the public. And they found that, the public doesn't really know a lot of little facts and figures about science. So they thought that, the public can't trust science because they don't know science. So a lot of scientists, the way they engage the public was just feed the public science. And that's not really why people trust or not trust science. We found this out a little bit later. So didactic education, again, made by scientists, all try to tell you about stem cells. And so their aim is to increase your literacy or the patient's literacy of the science of stem cells. So they talk about how stem cells work, how clinical translation works, why not to get an unproven stem cell therapy, or what questions you should ask if you're considering one. None of this, and we analyzed this education a while back, none of it has empathic language, doesn't recognize that patients are struggling. They have a chronic condition, they've exhausted all conventional options. They're looking for something, they're desperate. Some are desperate. And again, as I mentioned in our study, patients never heard of any of these materials. Now, difference between persuasion and manipulation. Let's talk about manipulation. Manipulation aims to deceive, okay? It uses tactics like lying, withholding options, clinical options, withholding information. It makes it seem that there's only one option out there, and that's to get that unproven stem cell treatment, okay? A lot of misinformation. Think about COVID misinformation, okay? A lot of misinformation, what does it do? It elicits emotion. It makes you angry, right? Your rights are being taken away if you have to wear a mask or if you're mandated to take a vaccine. So it elicits fear and regret, anxiety. So in the case of unproven stem cells, they may say things like, if you don't get one, you're not giving yourself the best chance at health. So literally, clinic websites would say these types of messages. They will do deceptive things. So they'll say, it's FDA approved. The device that you're using to inject me is FDA approved. Not the stem cell therapy, but they'll use that type of manipulative or pretty much lying type of language. So we think that there is a moral argument to be made for persuasion, okay? And so persuasion is not threatening, okay? Both didactic and manipulative, but even persuasion assumes what is best for the patient. So remember, we're doing what is in the best public health interest for the public or the health interest of individual patients. Manipulation, as I mentioned, hampers autonomy. It does not allow the individual to make a true autonomous decision. We think persuasion can actually be autonomy enhancing because if you're filled with misinformation, well, we can debias that misinformation and we can give you more facts. And that allows you to make better informed decisions. So we actually think persuasion is autonomy enhancing. And of course, there's a lot of social harms, right? Disinformation, misinformation distorts our understanding of science around stem cells or what have you. So, and again, there's a lot of mistrust of public health institutions like the FDA. And so we think, again, it will limit some of these social harms and improve public's understanding of science, at least stem cell science. So, as Dr. Iltis said, we use it all the time. We have advertisements. This one was kind of funny. Cover your butt, get a colonoscopy, right? We see this for breast cancer exams, self-exams, or going and getting your mammographies. Here's a pretty powerful one by the World Health Organization of a sort of a body bag, looks like a cigarette, to basically tell you to stop smoking. We do this in public health all the time. You'll see it around any medical center, et cetera, okay? Again, the goal is to debias patients and influence their beliefs. We don't infringe on reasoning. We use fact-based information, so we don't just make up stuff. We would have to use information to convince a patient based on some kind of evidence. The idea of using persuasive communication is to give you an empathic voice, to recognize the struggle of a patient. I'm not going to get into it, but we would probably be a great conversation about what type of paternalism this persuasive education would be, and it would be a sort of a soft paternalism, and I can explain that a little bit later. And it is, and again, persuasion is built on what we call dual processing theories. Do people know what that is? If you did health psychology, science communication, we don't make rational decisions, okay? Daniel Kahneman wrote this amazing book, and he's a Nobel Prize laureate, called Thinking Fast and Slow. Dual processing basically means we process things in one of two ways, okay? One of them is intuitive. It is super quick. We don't really think about it. If I say 2 + 2, you're going to say 4. If I say 2 + 2 × 3, you're going to have to remember your order of operations. You're going to have to do 2 + whatever I said. You're going to have to do the multiplication first, then the addition, right? Requires a little bit more cognitive processing. That's called system 2, reasoning, right? It's slow. You have to think about it. You have to read more about it. It's harder. A lot of times, we make quick judgments and quick decisions. And marketers are really good about that because that's how they can attract you in a supermarket or anything like that. And yeah, reasoning, well, that sometimes takes a bit of a backseat. Persuasion. There's also ways to persuade people. This is something, again, you'd see in health behavior. It's called a very known theory called an elaboration likelihood model. Basically, it says that if you're motivated as opposed to unmotivated, you are going to process the information. So if you care about an unproven stem cell, you're going to read the information. And all of our people, really, all of the patients that want an unproven stem cell, they are reading information. Unfortunately, some of that is just incorrect information. And then they will either have lasting persuasion or temporary persuasion. So sometimes, like how we vote is very much based on social cues, right? Do we like them? Do they look like me, or do I like what they say? It's not really thinking about necessarily their policies, but we make quick decisions. And it could be on voting, it could be on buying a car, and it could also be on whether I should get a mammography or whether I should get a stem cell treatment. So what does public communication look like? So I'm not going to get into much of this, but here's persuasive communication, okay? These have been done in many different areas, and I don't have time to really unpack them, but we can correct misinformation, okay? It's called debunking. We literally say the information you got is incorrect, and we tell them why. We can also inoculate against misinformation. Inoculation, just like you're getting a flu shot, same idea, right? We tell people, listen, you're about to encounter misinformation, so we prime them to be ready that they're about to counter misinformation. And so one of the ways we can do it is like the example on the phone, spotting a non-expert, right? It's easy. We can tell them, hey, and the cigarette, Big Tobacco has done this, right? They used to have doctors that said, tobacco, it's cool, it's okay to smoke, it's not going to harm you. But they're trying to sell you something, they're working for a big tobacco company. So, we can use these types of techniques to say, well, they may be an expert, they may have these MD, PhD types of things behind their name, but they're trying to sell you something, so maybe you should pay more attention or question their qualifications. And we can do the same for unproven stem cells. Two other techniques. Scientific consensus. This has worked very much so in climate change, right? Climate change has been an example of people saying, no, climate change is not real. Here's a scientist and a study that says it's not real. But the majority of scientists, like 97% of scientists, actually believe climate change is caused by, human interactions, humans. And so by explaining to people that there's actually a consensus, that's actually a powerful way of people taking in the message and believing it. Narratives. I talked about YouTube narratives that we did, right? Telling a story, for example, of a botched treatment of a patient, a true story, may be another way of communicating more effectively. So these are the types of persuasion techniques we would use. Again, after they read something, they're free to go and get an unproven stem cell treatment. But we're hoping that these types of techniques would debias them. And lastly, it doesn't have to be education like you get in a pamphlet or on the internet. It could be communication. So at Mayo, we actually had a really cool service which the powers to be decided to cut it short. We had a free consult service that if you were interested in a stem cell or regenerative therapy, you could call us and we would talk about it. Could we develop such a counseling service again? Or at Atrium or anywhere else? Or could we get physicians to talk about it? So we did a study to show that physicians are great at giving information about stem cell therapies, but they're also really good at telling patients, you know what, the decision is up to you. No matter what you do, I'll be there for you, I'll take care of you. So they also had a relational component to it as well. So they understood that their patient was suffering. Can we arm physicians with a misinformation toolkit? So when they come, and it doesn't have to even be about unproven stem cells, it could be about any major area of health misinformation. Can we basically tell them how to best deal with patients and not, yell at them or say, oh, that's stupid or anything like that. And so a lot of this talks about how we should communicate empathically, how best to communicate with patients such that they believe you. So I hope I've convinced you that persuasive communication is awesome and we should all be doing it. And thank you, Anna, and thank you, Sally.
We have time for some questions. Would you like to field your own questions? Do you want to just call on people?
Sure.
Okay. I will get off to the side and invite people to ask questions. Right.
So, is there any kind of stem cell therapy that actually works that you're aware of?
Yeah, so the question is there any stem cell therapies that work? The main one is for people who have blood cancers, like leukemia, and it's called a bone marrow transplant. What they usually do is they give you chemo, which eradicates all the marrow in your bones. And your marrow is where you produce a certain type of stem cell that constitutes your entire immune system. So by doing that, not only do they kill the cancer, but they kill your immune system. Then they reconstitute that immune system by giving you your marrow back. So they can take either peripheral blood or marrow from you, irradiate or give you chemotherapy, and then put it back into you. So that's the major one. And that's been around for like a long, long time. But there's not that many other stem cell types of therapies that are out there. There's some with skin. Skin is easy to regenerate, right? We cut ourselves, it grows back. So we can do skin grafting for, let's say, severe burn victims, things like that. But there's not that many stem cell therapies. They're all in clinical development, meaning we're trying to test whether it works on patients. Yep.
Have you seen much of this, the snake oil stem cell therapies in terms of anti-aging?
Yep. Yeah, so anti-aging is, yeah, so I'm sorry. The question was, have there been any stem cell types of therapies and things around anti-aging? So to me, anti-aging is this word that I don't really understand what it means. It basically, so there's a fear in society of getting old. And some people want to live forever. So for example, have you heard of young blood? So young blood is literally someone getting blood from a younger person because they think if they put it in their blood system, so it's literally a blood transfusion, that it would be healthy and make them younger or allow them to regenerate or live longer. There are also certain therapies that we know could sort of, again, in a dish, it could slow cell aging. So a lot of people are taking, I think it's called rapamycin or something, as a preventative of aging. So it's not necessarily always stem cells, but yes, people have taken it for, regenerating their system. There's also stem cell vitamins, which makes zero sense because there's no live stem cells in a vitamin that's dried up. But a lot of people also talk about, stem cells. It'll boost your, your internal stem cells. So does a regular vitamin. So does eating an orange probably, but they don't say that. But yeah, so the anti-aging is also getting to be more and more. But again, a lot of the people that are doing it are not necessarily doing it to live longer. They're doing it because they have a pretty bad illness. Yes?
Like preventative laws for these things like stem cell vitamins or like all this misinformation that's being spread by these clinics?
Yeah, very good question. So the question was, are there laws to potentially prohibit the selling of these types of treatments? There are. The FDA has made a lot of provisions. The problem is the 2,700 clinics in the US, they are all mom and pop shops. And FDA, with its 15,000 employees that regulates all food and drugs, cannot oversee every small stem cell clinic. So the FDA has given a bunch of warnings, and they obviously use a very legal approach to stop clinics. They've been mildly successful, but these clinics still continue to proliferate. It gets more interesting. State laws are all over the place. Some will tell you you're about to go and get an unproven stem cell treatment, and if you're selling it, you have to display a sign. I don't personally think those are effective. There's also states, including North Carolina, that actually has a pro-stem cell law. So you've all heard of right to try, right? Patients' right to try a treatment when they're ill. They base it on various right to try laws that they say that if you have a condition, you can go and get a stem cell treatment. It tries to bypass the FDA's authority. I'm not a legal expert, but I don't think the states can just trump the legal authority of the feds. But I can ask the lawyers in the room. I'm quite sure it could be challenged. I just saw Mark pointing to you, so that's why. Oh, Chris, if you know.
Do I want to add anything right there? No, but I'm looking into this, so I can add something. More to come. Good. Yeah.
You mentioned that a major way that patients internalize information is via pamphlets in hospital settings, and they're coming from all different sources. So I was wondering if there's any overarching regulation from hospitals or even other healthcare systems to ensure that these pamphlets
That's
are
a
distributed are factual.
really good question, and I actually don't know the answer to that. I don't know if there's oversight over information from medical institutions. Do any of the lawyers know?
I'm sorry.
So if there's any regulation for the information distributed via pamphlets
By
by
medical organizations.
From medical. Well, I mean, I think that you would have your just general, you can't say things that are not true or, malpractice type issues. that you can
Sure,
Used against
but
you.
that's just civil.
I can't think of any off the top of my head, but I'll continue.
Things that are really, one thing that comes to mind is things that are regulated under research. So if an institution is conducting research and you're sharing information about a specific research project, it has to be IRB approved.
Correct.
But
And if
beyond
it's a
that-
drug, the FTC, if you mislabel a drug, the Federal Trade Commission could go after and say, well, you're not. Even the FDA could also go after and say, but again, that's only for drugs. So when it comes to your pamphlet or your internet site, I don't know if there's oversight. At least not by a state or, I'm not really sure. Okay.
You mentioned like the evidence that might be like convincing to a patient, but what is your personal opinion on like what you think is the most effective patient narrative?
Most effective?
Most effective patient narrative.
Oh. So the question is, narratives can be used to, educate patients, but convince them. What's the most effective type of narrative? We're going to try in a study. So some patients have talked about botched treatments, them getting an unproven stem cell treatment, and how it sort of ruined their life. The one that's like most touching is when a woman who could see got something for age-related macular degeneration and they blinded her. And that ruined her life. I'm thinking things like that might work. We've had mixed results. A lot of patients blame that patient for not doing their research, and that's why they got harmed. They don't realize that it can happen to them, which is kind of sad. But yeah, so we're trying to test some of these narratives right now, but I don't have the data yet. Good question. Yes?
So how are physicians compensated for fighting this misinformation?
I don't think they're compensated specifically to fight misinformation. I think they have an ethical duty to they have an ethical duty to do no harm and do what is in the best welfare of the patient, right? That could constitute making sure that they have the right information when they're talking about a therapy, even if it's a therapy they can't give them at their clinic. So are they compensated? No. Some of these consultation services are a fee for service. They're not all free. I think ideally they should be free for patients, but they are a fee for service. And so they may get a little bit of fee if they have a person that kind of talks to a patient about stem cell therapies. But the model doesn't exist yet. Good question.
What time for one more?
Sure, back there.
What do you argue against or with people who have religious opposition to stem cell research or the origin of the lineage of the stem cells?
Yeah, that's a very good question. So most of the patients that come, so the question is people that have a religious opposition towards stem cell research, how do you talk to those types of patients? So interestingly, a lot of patients sometimes get confused that a lot of the stem cells come from either a very early stage embryo or a fetus, and that's not true. In fact, most of the stem cell therapies they're giving right now are adult stem cell therapies, meaning they're inside you and me. And so we don't truly know what they're giving all the time because we can't ask the clinic. No one's going to talk to someone like me. But they can get it from their blood. They can get it from fat tissue. They can get it from marrow. There's many, many places, but they usually like to isolate it from you. And they know, and the clinics know this because exactly what you said, a lot of people don't want an embryonic stem cell because it comes from an embryo, or they don't want fetal stem cell because it comes from an aborted fetus. And so for those reasons, there's actually, in the States, no one uses for these unproven clinics, no one's using an embryonic stem cell or fetal stem cell sources.
That'd take a lot of work.
Yeah.
Take a lot of work to do that.
Yeah.
Well, thank you. Please join me in welcoming Dr. We invite you to join us next door for a reception and to continue the conversation. Thank you all so much for being here.
Thank you.